In this video, I'm going to talk about 3 common trends or mistakes that I see trainees make when struggling to pass the MRCGP RCA. Of course, RCA has been around for a couple of years now. I'm Dr. Aman Arora from Aurora Medical Education. I've been helping doctors pass RCA since it began. It's still the temporary replacement for the MRCGP CSA exam, but over the time I've seen certain trends develop, and I've seen people struggle with RCA with some really simple things that can turn around people's marks when it comes to the assessment. So 3 really important things that I think you should focus on if you are preparing for MRCGP RCA right now. Let's begin. So the first trend I see, or first mistake I see, is that people don't give themselves enough time to first prepare for RCA, but then ultimately do the recording. It often ends up being a kind of rush job, and that might be because you're about to CCT, for example, complete training, or you've got a window for RCA that you don't want to miss because the next one's quite a while away, or whatever it might be. You just want to get out of the way. It takes time, okay? It takes time to prepare for RCA, to understand what actually is being looked at from the other side. What are the kind of things that you need to try and fit into your consultation? It takes time to prepare how you're going to set things up. It takes time to prepare yourself and get used to being recorded and having that thing in your brain saying that I'm being recorded here, but I've still got to deal with this situation in front of me. It takes a lot of practice, and you've almost got to write off maybe the first 2 or 3 weeks or a month of recording just to get used to that feeling of A, recording, but B, trying to work out what is a good consultation. How can I use my 12 minutes as effectively as possible? How do I manage my structure or my time in that consult to demonstrate certain skills? If you haven't taken the time to prepare by understanding the kind of things that are being looked at from you, how things are going to be marked, and what is your job to do in those 12 minutes, if you haven't cracked that bit and understood that and then practice things and rehearse things and change things and alter things, then when you come around to recording, it's going to take you an extra month just to get those things right. So it takes time to prepare for RCA. People often kind of jump in and think, I'm just going to get it done in a month, and that's when the pressure comes on, and that's when you may be submitting things that A, aren't up to the standard that you would like them to be, but also B, are not hitting the right marks in terms of what is going to be looked at from the assessment point of view. So if you need any help with preparing, then make sure you look at some of the other stuff on the channel. Hopefully you can help you with that, and some of the resources can go through how you can maximize your time in a consult so you can prepare your mind, but also prepare yourself for technicals like the feeling of being recorded as well as being assessed and dealing with a real life patient at the same time. So number 1, I see people have lack of preparation time, but also lack of recording time as well. And it's a really simple one, but it's amazing how much of a bit of planning and a bit of extra time and starting a little bit in advance can really, really help with RCA. Trend number 2 that I see is that people want to aim for perfection. People try and achieve too much in 12 minutes. Like, you don't need to do everything in a single RCA consultation. You don't even need to finish the consultation by 12 minutes for it to have its maximum effect. But people, being clinicians, we're often looking for that perfect consultation. So we strive and we strive and we strive to get 13 faultless consultations. That's of course impossible, and is not, real life doesn't allow you to do that really, and there's so much that goes on in a real life consultation. But people kind of have this thing in their mind that I only want to submit things that I'm 100% happy with, and that leads to you sometimes cutting corners, not being the normal doctor that you are, losing out on things like interpersonal skills because you're trying to achieve what we think is perfection, and therefore we may be missing a few things that actually are going on in the consultation itself, and that therefore impacts how things are being watched and assessed, etc. So remember, with an RCA consultation, you do not need to aim for perfection. You're okay to have a consultation that maybe has a few little things that don't go quite right, that you weren't quite happy with. If you think back, for those of you who have done RCA maybe in the past, how many consultations have you let go that just because they had a small thing that you weren't quite happy with, okay? This is real life. You're not in a fictitious situation like a role play here. This is real life. It's not going to go exactly to plan. So as long as you have demonstrated certain things, and this goes back to understanding what actually is being achieved or what you're supposed to achieve in 12 minutes, as long as you are understanding a situation properly from a clinical, non-clinical point of view, and then putting a plan in place that takes the story forward, that is safe, that's looking at your issues and the patient issues, then generally you've probably done enough to get a really good score in an RCA case. If you're looking for that case that you understand everything in the first half and then you manage everything in the second half, you're trying to achieve too much, you're trying to get to the end, you're trying to cover everything, A, you're probably going to stress a lot because it's quite a lot of pressure to try and get 13 things that are absolutely perfect. And B, you're probably going to be missing out on things in consultations because you're so focused on the perfect consultation, you're going to be missing a lot of other things that could actually show a lot more genuineness, a lot more interpersonal skills, and a lot more flexibility in terms of how you manage a situation at that given point. So please don't try and achieve too much in your 12 minutes. Please don't try and aim for perfection. That is not what is needed to pass your RCA. So 2 down, before we go into the third trend that I see in people who struggle to pass RCA, a quick word about the discount coupon. Aurora Video 10 is the coupon to use if you want 10% off any Aurora RCA resource or course. And I'll talk about those in a bit more detail at the end of the video, but Aurora Video 10 is a coupon. And if you're finding this video of some value, please do subscribe to the channel so you can get much more in terms of helping you through your RCA assessment. Let's get back to number 3. So the third trend that I see in people who struggle to pass RCA is that their consultations are very good, but they're so heavily focused on the clinical side of things that you neglect to demonstrate other skills. Now, when someone comes in and you see, I don't know, a knee pain, for example, yes, you're going to spend some time working out what's the diagnosis, ruling out the red flags, doing an examination, diagnosing a problem and treating the knee pain. And that all may be perfectly correct and guideline based, and you may not miss anything out. But it doesn't mean you're going to get a very high score in that RCA assessment. Why? Because there's so much to think about other than the clinical. As clinicians, we look at clinical first, that makes sense. But remember, you're being assessed here in terms of assessing a situation as a whole, and a situation as a whole comes with many more issues than clinical issues. So for example, I see people neglecting things like psychosocial in a big way. I see people neglecting things like ICE in a big way. These are all important issue gainers. Data gathering is about gaining issues. Yes, you can get clinical issues for the doctor, but don't forget issues in the patient's life, and don't forget issues in the patient's mind. So people often leave a lot on the table because they don't ask these typical questions because they're so focused on clinical. And similarly in management, you may well understand that there are life things going on like work problems or home problems or smoking, alcohol habits, etc. You may understand those things. You may understand that they're worried about, I don't know, a holiday that's coming up and is it going to be impacted, or they're worried about a test that's coming up. You may understand that they want an x-ray, for example, but in the second half, these things are just not mentioned. Why? Because we talk about the clinical stuff a little bit too much. So one of the real common trends that I see when it comes to RCA is that consultations are very good and we expect to get very high marks because there's nothing wrong in the consultation, but maybe we've left a lot behind on the table because we haven't focused into the non-clinical areas, either by asking those questions in the first half or by discussing them and bringing things back in the second half. And if you struggle to get that balance right in terms of asking the right questions and how do I manage all of that in 2 or 3 minutes, have a look at some of the videos on the channel or use some of the courses that we do, because we focus a lot on using your 12 minutes effectively to maximize your score both in the first half and in the second half. So trend number 3, don't be too clinical. Make sure you look at the bigger picture, the wider picture, both in the first half but also in the second half as well. So guys, to recap, 3 super important trends to look out for if you are preparing for RCA. Number 1, make sure you have enough preparation time, both for actually understanding what's being expected of you and also the recording part as well. Number 2, understand that you do not have to do everything in 12 minutes and you don't have to have the perfect case in order to submit. And number 3, make sure you're looking at the bigger global picture and not just the clinical stuff that's sitting in front of you. These 2 things, I promise you, will help boost your RCA scores. Now, a quick reminder about the coupon. Again, we do lots of stuff for RCA, whether it's online courses, audiobooks, flashcards, etc. If you want anything in terms of RCA from us, please use the coupon Aurora Video 10 for 10% off. Click the link to have a look at some of the options available to see how we can help you pass RCA. But I really hope this video has been of some value. You know the hashtag, CanPassWillPass, hashtag I went with Aurora. Have a great day.